and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, Better Together, Partnering to Address the Social Determinants of Health. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluations are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be awarded for 2 years for social workers expiring on April 30th, 2020. As we get started, I'd like to introduce our presenter today, Julia Sosa with Watley Health Services. She is a familiar face to many of us at ADPH, as she previously served as the Director of the Office of Minority Health. Welcome, Julia, and let's get started.
All right. Well, thank you for inviting me to talk about such an important topic about social determinants of health. Throughout the next hour, I will try to explain to you guys what are the social determinants of health, how they will impact access to health, healthcare, health status among different populations. I would also try to explain how you can partner with others to improve the health of the community you serve, and also to improve the health, especially your Alabama residents. So first of all, I want to talk to you about the different what encompasses the social determinants of health. And as defined by different organizations, the social determinants of health are the neighborhood and the environment, health and healthcare, social and community context, education, and economic stability. Throughout my presentation, I will address how each of these can affect an individual, a community, and if you're trying to provide healthcare, education services, any kind of social services, how can you address different issues? And also, I hope that you learn how these different determinants of health or social determinants can impact an individual. So first, let me define it as social determinants of health are conditions in the environment in which people are born, they live, where they learn, they get their education, not just elementary and high school, but higher education, their place of employment, their work. Is their work accessible where they live, or do they have to commute? Do they have to drive? Where they play, where they worship, and you know, age is very important also. So all these factors that I already mentioned, where you live, where you work, where you go to school, affect your health, affect your functions, your functioning in life, and actually it affects the outcomes and risk of an individual. So what are some of the resources that enhance the quality of life? So if you look at the slide, the safe and affordable housing. So if you're addressing, you know, environmental factors, and you're addressing an individual that is under stress, or you're addressing, you know, if you're a provider and you're encouraging people to walk on their neighborhood, you're encouraging people to adhere to their care, you're addressing with that individual, you know, I want you to exercise in your community. And what if this individual doesn't even have a place to live? Or what if this individual lives in a place where there's gunshots every day, where there's breaking into the houses, where there's threat, and you know, and sometimes we make assumptions that these communities are only low-income communities, and this actually can happen in every socioeconomic status. It can happen in a middle income, or it can be in a high affluent neighborhood. So again, you know, when you're addressing where do you exercise, where you live, take the time to ask, you know, what community, where do you live, or what can we do to improve your communities? The other thing that can affect a person's life is access to education. Yes, we live in the United States. Yes, we live in Alabama. We make the assumption that everybody has access to education, but what's the quality of education? Even if it's public education, are they having equity of education among a county, a city? Are there, you know, the best schools only in the high affluent neighborhoods, or is it all over? Do the children have the same access to programs that others do? And then again, you know, coming a parent that I had children in public and private education, sometimes private education doesn't offer the programs that are offered in public education. So when you look at public safety, do you have the resources to pay for, you know, a police station? Do you have access to security? Do you have access to, you know, how long does it take if you dial 911 for somebody to respond? And if you live in a neighborhood where it is assumed or is talked to, oh, you don't want to go there because you might get hurt, how do you know that they do not have the resources to be protected? You know, I was reading the other day about how in Alabama funds are tight and how within public safety the state troopers are very represented in the sense that they don't have enough staff. So when you think about just the safety of the roads, if we don't have enough staff, how do we know to ensure that people are not driving too fast? The statistics show that more people died in car accidents. How do we know if somebody has car trouble and it's not in the safest area or in a remote area? If you don't have enough state troopers, how do we know and ensure that somebody can have a peaceful, safe life? And then, you know, I will address availability of health foods throughout my presentation. And coming from a dietitian and also working in a federally funded clinic, and through the years we addressed access to food. You know, we tend to, as providers, we tend to say to people, we want you to eat better. We want you to increase your fruits and vegetables. I know public health has had many campaigns of increasing, you know, at least many years ago, at least 5 servings of fruits and vegetables. Now it's 9. But how can we? Yes, we can educate people about eating more fruits and vegetables, but if you live in a neighborhood where it's a food desert, and I know that we could talk for hours about food deserts and availability of healthy foods, we can look just around downtown Montgomery. There is not much access. Yes, we have the farmers market, and yes, we have, you know, a grocery store, but it's miles and miles away. So when you think about how the food choices that people have, we also have to think, what kind of food choices do they have in their neighborhood? I know that before I retired from public health, I did a couple of community assessments, and in one of the towns that I'll address how to partner with others, the closest grocery store for this very impoverished neighborhood was 10 miles. So how do you tell somebody that doesn't have transportation? How do you tell somebody that doesn't have even sidewalks? How do you tell somebody that lives on a fixed income that you need to eat better when for them to access healthier foods is 10 miles away? For some of you, that might not mean much because you have a car, you have resources to pay gas, and in your neighborhood, you might have a grocery store that is a couple of miles away. But for some people, it's 30 minutes to an hour drive. So moving along, other resources that can affect quality of life is local emergency and health services. In Alabama, I haven't checked the latest, but there are some communities that do not have a hospital. There are a couple of counties that don't have a hospital. There are a couple of counties rural counties, that will have an emergency room, but then the patient is mainly stable and then is shipped or traveled to a larger county. And also the thing is, you know, ambulances, they cost. So there's communities that they might only have one truck. And so if they have several calls, how do you prioritize? If it's something that needs immediate assistance, then it's the issue of, you know, am I going to be the next one to get the service from an ambulance? Or, you know, and later in the presentation, I'm also going to talk about a project that I'm working at Wadley in regards to prenatal care. If you live in a neighborhood or in a town or in a community that does not even have an ambulance, and the ambulance is at least 30 minutes and you're about to deliver a baby, how can you make it safe? Or how can that mother have a positive outcome if there's not resources near? And then environments free life-threatening toxins. You know, I know that in Alabama, you know, with the oil spill many years ago, how has that affected the environment in South Alabama? If you look in other parts of the United States, I'm not going to specifically address Alabama, where the water was contaminated and it was a big issue. And so when I think about things of the environment and life-threatening toxins, I always think, you know, we live in the United States. We live in a super powerful country, yet we do have issues in dealing with environment, in dealing with toxins, and in dealing with nature. You know, if you look at California, the fires, what has those fires, how has it affected the environment, the air? If you think about Alabama in regards to toxins, I'm thankful that we have regulatory services and agencies, but do they provide the same equity of service to all communities, or do they focus only on communities that makes them look good? So as we look at social determinants of health, there's two things. You can have social determinants and you can have physical determinants that affect the life or the well-being of an individual. So when we talk about social determinants of health, the things that come to my mind is the availability of resources to meet daily needs. How do people know in a community what resources are available? How do people know to reach those resources? How do the community know the hours of service? How do people know what are the things that they need to have in order to receive those services? And so, you know, yes, as an agency or as a federally funded clinic, we tend to think, okay, we have everything in place. We have our hours of service, we have our staff, we have our different programs, we have pamphlets that educate the community of the services that we have. However, and if you think about the people, the population you're trying to serve, are we meeting their daily needs? Are we providing equity of care? And what I mean by this, if you're an individual that works from 8 to 5, and you work in an agency or at a place where you don't get any time for sick time, and you get paid minimum wage, and for you to take care of your health means that you have to take off work because the hours of service are not available for that individual after hours, how can they have access to care? And then the other thing is that even if the hours are from 8 to 5, and in some clinics, they have clinics on Saturday, like Watley has clinics on Saturday, every other Saturday, how do they know that they can receive that service? So then another social determinant, which for me, education is power, is access to educational, economic, and job opportunities. And what quality of education are these individuals having? When I look at statistics and I look at Alabama in comparison to other states, and when I look at the education and the priority that is given to education, you know, at times it's sad for me to see that, yes, Alabama is not a rich state, and yes, Alabama has issues with funding, but it's interesting what priority they put in education. If you look at, yes, I'm thankful that Alabama has pre-K now, but when you look at it in the different neighborhoods, who has access to a pre-K service? And, you know, from when I was in school and from different trainings that I have had, the importance that is given to education in the first 3 years of life. What if some children don't have that opportunity? Or what if those children don't have the opportunity, the parents, to drive them to a pre-K program? And then the other thing is, yes, there's economic impact, and there's economy flourishing in Alabama. Alabama right now has one of the lowest unemployment rates, but then it's interesting to see where the job opportunities are, what happens to some of our counties that do not have as many resources, as many agencies. Do the people in that community have the same availability? Do they have the same economic chance? Or do they have to drive in order to have that opportunity? And then also, even in rural and urban areas, if there's agencies where they provide education, but is the education only offered to certain levels of that agency? Is the education offered to all equally, or is it only for managers, or is it only for shift supervisors? And so in order for education to have an impact on all, I think everybody should have the same access, or at least have the option of saying, yes, I want that education or not. So when you look at social norms and attitudes, I know that there's the words of classism, racism, discrimination are kind of like the monsters in the room, and then also the distrust of government. However, I think it's very important that you address as an agency, or if you're providing care or trying to improve access to care, that these words are mentioned, and that these words, and I put them between quote marks, are addressed, because sometimes, you know, people in Alabama has a history, long history, in the history of trust in different groups of populations, that the issue of trust is the must. And then if that individual feels that they're not getting the same equity of care, do you think, I don't care that you have the best doctors, best nurses, social workers, dietitians, if they know that they have been mistreated or treated differently because they look different or they talk different than you, they're not going to come. So, you know, one of the things, if you learn something from me today, is paying attention on addressing and making an assessment of your agency, of how you assess, how you educate, how you provide continuing education in regards to addressing race, class, education, and trust. Because I think that, and I'll give you an example, and we are almost through, I hope, with the flu season. We have done education to immunize all, and even some agencies provide the immunization free of charge. But in certain groups of people, especially, and I'll mention the African American community and the Latino community, where there's a lot of distrust in the shot, and they say, oh, when I take the flu shot, it gives me the flu. Education needs to be addressed with everybody, but it needs to be focused to enhance the issue of educating and saying, you know, this is what you heard, this is what we know. And yes, that shot might cause you a little bit of symptoms, but it can prevent you. And, you know, we had several deaths in the state. I don't know the demographic breakdown of the people that died, but that is one thing that I would look into. Even, you know, something as scary and as strong as it was this year, the flu shot. And, you know, I learned yesterday that, you know, when we're about to get an audit at our federally funded clinic, and Joint Commission now, especially for hospitals, is expecting 100% immunization for the flu. So how would you address that with your staff? If there's the issue of distrust, is there any policy in place in case that staff doesn't want the shot? What are their choices? How do you educate that? And, you know, at times we cannot ignore our beliefs, we cannot ignore our values, and we cannot ignore our upbringing when we are addressing different issues of health. So also another social determinant is transportation options. You know, I'm lucky to live in Tuscaloosa, and yes, around the university and around the city areas, there is transportation. And it comes at certain times of the day, not often. But as you go outside the county, outside the city limits, there's not much. There's not many options for somebody that has a fixed income, that might live out in the county, that might have physical disabilities, that might have fear of being around other people. And so when we offer healthcare services or access to healthcare, we cannot ignore the transportation issues that you have in your neighborhood and your community, because sometimes it might not be that the person doesn't believe or doesn't like your services or doesn't want to get healthcare, but it is the issue of transportation. Last week, and because of the hippopotamus, I can't say much. That's HIPAA for you. I'm trying to have some humor here. I asked somebody that why had they missed their appointment, And so the individual said, ma'am, because every time I come to clinic, I have to pay $40. And I did not have the $40 to pay for my ride. And then he said, and even if I had had the $40, my ride couldn't bring me to at the time of my appointment because they had to work. So transportation is not only do you have buses, does your clinic has a van that offers, to pick up those that don't have transportation, but also if they depend on somebody to bring them to their appointment, what are the times available for that appointment? Do you take the time to ask your patients, is this appointment time good for you, or is that good for the person doing the appointment? And then, and that's when I go, how much equity of care are you providing, in the sense, do you take the time to ask? I know that I only can schedule patients between this time and the other time, but is that feasible for that patient? And then this is a passion of mine, which is a big social determinant of health, is language and literacy. And first I'm going to address the issue of language when we speak the same language. I'm not talking speaking different languages. When we speak in English, are we providing the information at a literacy level, education level, where people can understand? Are we communicating in lay terms, not in medical heavy-duty terms, when we're speaking just English? Are we communicating not only verbal, but in writing? Is the message clearly to understand? And is the message relaying what you want to relay? Especially regardless of whatever a health topic you're talking about, or, an example that I have here is at the federally funded clinic is based on income, and there's a sliding fee scale. And, in the different pamphlets that we have, we say that services are provided regardless if you have insurance or not, and that, the cost of the service is based on your income. I don't think anywhere in that pamphlet it says when you come for your appointment, bring a check stub. And then how many check stubs do you need to bring? And then it says it's based on your household income. How do you define a household? Is it your immediate family? Is it everybody that lives in your house? Is it everybody that works in your house? And this is speaking English, verbally and written. So now if we put in Alabama has a growing Latino population and an Asian population, and when things are interpreted or translated, are you relaying the message the way that you want it to relay? Is the message explicit in understanding by the populations that you're trying to serve? And then when we address literacy, what level of education are your pamphlets or your education or your staff or your messages, your commercials, your publicity, or any kind of health campaign? And I know that in Alabama there is a group of people addressing literacy, and it's the Literacy Task Force from the state, where they're looking at what are factors that we need to address. And so then when you think about literacy, we might make the assumption that everybody can read and write, and we might make the assumption that everybody has had a health care appointment and that they have given instructions. But there's individuals that at times have never been to a doctor, and when they give a prescription and say you need to take it twice a day, when does that mean twice a day? So as simple as the label on your medication can affect adherence to care, or can affect how that individual deals with the instructions that their provider is given. Another social determinant of health that is really that we cannot ignore, and when I address racism and classism, is culture. What is your culture? What is your upbringing? What are your beliefs in regards to health care? What are your beliefs in regards to health condition? What is it for you to be healthy? For me, healthy is just the fact that I'm alive because I'm a breast cancer survivor. But for some, healthy might mean that they can get up and get out of bed. So again, how is the culture, the population you're serving, what is their perception of health? What is their perception of access to care? And I'm going to take a little bit here to talk about one of the challenges I have. I am working with a prenatal program, and I am trying to increase the enter into care in the first trimester of pregnancy, not on the second or third trimester. For the Latino community, which is about 90% of my patients, to go to the doctor means that you're sick, that you need help, that you need care from a doctor or a nurse. To be pregnant for some Latino women, it doesn't mean to go to the doctor. It means it's a sign of joy. Why should I go to a clinic? And so to educate the culture that if they're in the United States, and ideally what is expected that if you're pregnant is that you get access to care, and ideally in the first trimester, which is the first 13 weeks, it's very difficult because for them, like I said, and I have a large group of Guatemalan indigenous patients. In Guatemala, they say, you know, we never go to the doctor and we birth our babies at home. So why are you trying to ask me to come in my first 13 weeks when I'm doing great coming at 25 weeks? But for a provider, for somebody to come in at 25 weeks, you have missed the opportunities of, you know, the ultrasound. Is there anything wrong with the baby? Are you gaining enough weight? Are you taking your prenatal vitamins? Do you have any issues of violence that can be toxic to the fetus? However, for them referring to the Latino woman to go to the doctor is when they're sick. So then when you look at that culture and you try to look at what your task at hand is, we cannot ignore their culture. We cannot ignore their upbringing. And let's not go to another population. Let's focus in the state of Alabama. How many people, and I'm going to address diabetes, that is an issue in all groups. There's people walking around that have diabetes, but have they taken the time to go and have it checked, to have blood work done? And at times, if you have the right kind of health insurance, for some to pay $35 copay, it's huge. But yet, you know, how do they know that they're dealing with diabetes if they haven't been checked? And then what is the culture is, well, I don't know if I want to go there. I don't know if I want to go to that clinic. And in some rural areas of Alabama, the clinics that are available are mainly your federally funded clinics, and there might be individuals that would not want to go to a clinic where only low-income people are served. So then what is the culture? What is your perception of where you need to go for care? Does it have to be a prime, pristine clinic, or can it be a mobile clinic? But to me, the importance is to know that there is at least access to some kind of care in your neighborhood. So when you look at physical determinants, which is another area that affects the social determinants of health and ultimately the health outcome of an individual in a community, you look at natural environment. And what do I mean by that? For example, green space. There's communities, and you know, sometimes when I'm in a new neighborhood, I drive around and I want to say, okay, I'm going to go and see a new subdivision. And I go, okay, do they have trees? Do they have grass? Do they have walking, sidewalks? Do they have a place where pedestrians can cross when they're going from one street to the other? And then, you know, it's interesting to see that based on the income of that neighborhood, what is available and what is not. Even in a very poor neighborhood, if they have old trees, are those trees going to crack with the storm that comes? How is it going to affect the house that is under it? In regards to, we try to encourage people to exercise outside, to be outside in the beautiful air. So how do you know, are there any places available for them that have a pretty tree park and grass and garbage can that where if they want to walk in themselves or their dog, is there something that is appealing? You know, then the climate change. Look at the climate we have had for the past couple of months. When in Alabama did we have low temperatures in the latter part of April? So climate change affects, our health, our moods affects access to going to the doctor. If you hear a tornado warning, and you have a very important appointment, are you going to ignore the warning, or are you going to go to the doctor? Well, you know what? I would call my doctor and say, look, there's a tornado warning, I'm not coming. But we tend to, sometimes we don't keep the climate in check. And also, how does weather affect activities? And I know that this in regards to, you're probably saying, where is Julia going with this? You might have planned a beautiful health fair where you were going to have access, you were going to have screenings for diabetes, you were going to have screenings for HIV, you were going to have screenings for BMIs, weight, and blood pressure, and you even had a mobile unit that was going to offer, other kinds of services like eyesight or hearing. But if there's bad weather, do you think the people are going to come out? So at times, your worst enemy is nature in your environment. And so then also when you look at, as if you're designing, or you're trying to collaborate on different public health campaigns or issues, you have to think, and I'm going back to one that I was working at before I retired from public health, and it was looking at different hotspots to see what accessibility they had to healthy food and to physical environments. And, some of the towns that we picked, some neighborhoods don't even have sidewalks. Some don't even have roads. They have dirt roads, which they're still roads, but they're not roads that where people feel comfortable walking. Is it stable enough for somebody that has balance issues? And then, in some neighborhoods, abandoned buildings are scary. People will not want to go around because sometimes the assumption of an abandoned building is that, who's inside? Is there any crime? Is there any drugs? Why is it abandoned? And then, at the same token, it's sad to see in some neighborhoods, either rural or urban, how neighborhoods kind of go into the ghost area where buildings, businesses close. Businesses are not kept, buildings are abandoned, and that affects, how a neighborhood perceived as being, a safe neighborhood or not. And then physical barriers, what I mean with physical barriers as a determinant of health, if you have any kind of disability. Are the places where you want to go, do they have rails for you to grab yourself? Do they have, I hope they do, doors wide enough for a wheelchair to go? If you have problems with your sight, is the light effective for you to be able to see? And not only that, if you have physical disabilities, and not necessarily that you were born with them, but say an individual that had a stroke and they have issues with balance and issues with, and issues with walking, wherever they go, do they have access to rails? Do they have access? Does your clinic have wheelchairs? So if somebody has balance issues, that when they come to clinic, they sit on your wheelchair and they can go around that, because sometimes that might be a barrier for somebody to come for their appointment because they're afraid of falling, they're afraid of hurting. And then, that clinic might not have an available wheelchair or even staff to help that patient walk. So in that sense, your disabilities can be one of the barriers of you accessing or wanting to access healthcare. Also, in the different communities, are there work sites, schools, and recreational settings? One of the things that I do when I talk about different things to access the different groups of people, I go, okay, what is it on their neighborhood? Is there a place of employment that they, like, for example, I love seeing all the Dollar Generals, because somebody that doesn't have transportation and there's a Dollar General that they can work at and they can walk from home, to me that is something important for that person, that they can walk, they can work, it's economy for them, they feel that they're being useful, and yet they don't have to depend on a car or on transportation. Another thing is, for individuals that work more than one job, are there any recreational places in their community where they can go and distract themselves? I'm not saying bars And drinking, I'm talking more like, is there a park where they can go with their family or with themselves, or if they have a pet that they can walk their pet? And is that park in a safe area? Is that park have the proper lighting? Does the park have a place for them to sit if they get short of breath? Does that park have garbage cans, so if they want to drink something, they can deal with garbage? Because some of the things that affect neighborhoods and affect perception of where they live and affect how they deal with their daily activities is, do they live in a neighborhood where there's no garbage services and garbage builds up? I don't know right offhand of any place here in Alabama, but in big cities that happens. And if they don't have services where the trash is picked up, what happens? The trash keeps building up. What happens if there's trash? There's bugs, there's, all kinds of pollutants, and that affects the people living around it. And then, do we tend to think about aesthetic elements? Do we tend to think, okay, we are going to assist this community, we're going to see if they have playgrounds, or if they have not only playgrounds for the young, but also places where older people, the U.S. population is aging. They're not dying at a younger age. They still want places where they could go walk. Is it friendly? Do they have policies because some people are afraid of dogs? Does your dog have to be on a leash? Because if somebody is an older person and has issues with ambulation and balance, they will not want to go and walk at a park where there's dogs running crazy and they can be hurt. So, I don't know if you had thought about all this as you think about what affects, your social determinants of health in regards to the health, not only of an individual, but a community. So when you look at the different, if you go to the first picture that I showed, and it's the 5 different areas where it's economy, it's education, it's health, is food security, I'll address each one individually. And for example, economic stability, is there employment in that county, in that city, in that town? What is the access of food? I remember a couple years back where the water was an issue in a county, in a town south of Montgomery. Did the people knew how to deal with the water? Did they knew that as simple as boiling it in your stove? Did they knew that what had contaminated the water? Yet, we are thankful to live in a country that has a lot of resources, but sometimes we make assumptions that everybody knows what would happen if they didn't have running water. What would happen if, Lord forbid, there would be riots and there would be any demonstrations and the grocery stores were closed? Where would people access food? We make assumptions that the grocery stores are always going to be open, but at times that doesn't happen. And then again, in regards to food insecurity, one of my partners is the Extension Office, and they're helping me with my prenatal classes and a prenatal program. And and they have a survey so that we can see the impact of we're making an impact in that community. And one of the couple of questions they ask is, during the month, do you have food every day? Do you have the resources to buy food every day, or you go without for a couple meals? And if it's the pregnant mother, do you stop eating so that your children can have food? And then the other one is, are there days of the week where you run out of food? And you know that hunger and poverty is an issue in the state. And even some, and I'm thankful in regards to access to schools, because the children that come to school can get free or reduced lunch. And so that way, if that school offers it, that at least they have breakfast and lunch. But what happens with supper? What happens on the weekend? I know that I was involved in a fundraising activity 2 weeks ago for Secret Meals. And it's actually a program, and I know that I know Auburn has it, I know Tuscaloosa, I know Birmingham also, where there's different organizations that they provide They do backpacks for the weekend for the children to have something to eat during the weekend. You know, if you don't take time to look at what's going on in your community, how do you know that that's happening? And if you're the type of provider that your role is to get to your clinic and provide care, but how can, and I'm going to bring my dietitian hat, how can I expect for an individual that has issues with cholesterol and with high blood pressure and diabetes and heart issues, but I know that they live with a fixed income and I know that they live in a very impoverished neighborhood that maybe only has a mom and pop shop, how can I ask them that every day you have to eat fruits and vegetables when I know that they don't have that security in their neighborhood? In regards to housing, you know, Tuscaloosa, it will be, I want to say the tornado was in 11, so 7 years ago, there were neighborhoods that were destroyed. And to this day, there's still some people that don't have a stable home because there's not availability of low-income residents. So where do these people live? And then, you know, poverty to me is so interesting because you can be working 40 hours a week, making minimum wage, and you still are under poverty. So it's not that people stay home, that people depend on a welfare check, that people are lazy, that people don't want to work. I have news, no. It's based on their income and based on their resources, and you may have individuals that work and yet still be under poverty, and that affects everything, your priorities. How do you prioritize your health versus buying food for your family or even yourself? Or if you're a caregiver and you take care of an elderly, how can you prioritize you going to the doctor when you know that that money you're going to pay for the visit will pay your mother's medicine? You know, something as simple as that. So when you look at education, and I already mentioned before that education is power, that whatever you have on your brain, nobody can take it away. But how do people perceive education? How do people perceive, you know, staying enrolled in school? And I'll go and address the issue of high school. If you come from a family where their parents maybe only have 6th grade level education, not by choice, but by need, and then they need assistance for you to work, your parents probably will encourage you, you know, you know how to read, you know how to write, you need to go work. So for them, and especially, and I'll bring this monster, especially if they are part of an undocumented family, i.e. parents don't have documentation, they're born in the States, parents don't see how they can pay for their child's higher education, so the pressure starts, you know, you need to drop out of school so that you can work, you can learn how to work. Mind you, one of the things that I'm also doing with the populations that I'm serving is to emphasize the importance of at least graduating from high school, and that can open you doors to a training program, or, you know, if you later in life you want to go to school. But to finish, and if it's not that, because you have to work to help your family, that you at least get your GED, that can open doors, but not to stop. And then, you know, in some parts of the state, high school dropout is higher than others, but do we hear about it? Do we talk about it? Do we address that when they come to the healthcare appointment? Do we address, you know, are you interested in higher education? Not necessarily go to college and get a master's PhD, but a traineeship program, a 2-year program. There is need, a huge need, with all the different factories in the state with labor, and yet do we hear much about it? Yes, there is an input and an influx, but in just certain communities. It's not equity. It's not the same in all the 67 counties of Alabama, in all the urban and rural areas. So that's another thing that you need to look at. And then again, you know, language and literacy. Do you go to a school, if you were brought to this country and English is not your first language? Are you understanding what you're learning? Are there any specific programs that can help those that speak a language different than English? So all those factors, you know, education is one of the major things within the social determinants of health that can affect not only where you work, can affect not only how you perceive different services, not necessarily just health, but, you know, social services. Do you need assistance from a case manager? Do you need assistance for living? Do you know where to access if you don't have a house? Do you know about the housing authority? Do you know what they're asking? Do you know how to ask? Do you know how to read? There's a lot of people in Alabama that are not from other countries, that are not undocumented, that they don't know how to read and write. Yet they're not going to come and tell you, look, I can't read. And yet, as a provider, are you making the assumption that they can read the information you're giving them, or that they can even read any message, or as simple as the label of the medication they're getting? And then how is that message reading on that, written on that bottle of medicine? If they cannot read and it says you must take this medicine with food, how are they going to know? Yes, you can put symbols, but do they know what the symbol means? And so, you know, there are things that we take for granted, but that we could easily educate people. And then when you look at another major part of the social determinants of health is the social and community context in regards to what's happening in that community, what's happening in that environment, what is happening, you know, in regards to, you know, and I'll give you an example that affects not only now but later, how people vote and people that came out to vote. That civic participation, if you want changes within your community, but you don't participate in voting, you don't participate in city council meetings, you don't participate in voicing your opinion, how do you know they're going to make changes that you need? And then in regards to, and it happens in Alabama and it happens in different communities, even in 2018, there's still prejudices. There's still discrimination. There's still perception that just certain groups have more issues of drugs, teen pregnancy, substance abuse, alcohol, and yet that happens in all groups. And then, you know, in regards to incarceration, what is a percentage? I believe most of our prisons are overflowing. What can we do different to prevent for that child or that man or that woman to be incarcerated? What can we do if they're incarcerated? What programs are there available when they come out so that they can be back into society? Are there the means? Do they know where to go? Are they willing to learn where they want to go after they leave prison? And then, you know, when I was doing programs at the prison, I would take time to ask him, what brought you here? And most of the time it would be experiences that happened to them when they were children. And so when you think about it, you need to look, you need to pay attention to the different stages of life. And then, you know, one of the new things, and it's not new, but it's popping up more and more, is toxic stress. And yet research has proven that toxic stress happens in utero and thereafter, and yet we don't think about that. We assume that if a child is misbehaving at school, if a teenager is showing off, that, oh, they're probably in drugs, they probably come from a poor family, and, you know, there's no hope. You don't know that if you don't take the time. And then, you know, one of the things that I have enjoyed since I have been in Tuscaloosa is how different communities from different races and socioeconomic levels come together and address an issue. To me, that's pleasure, because it's not just the rich together, the poor together, the middle class. Is different walks of life addressing how they can improve a neighborhood and an issue that is going on. So, in regards to health and healthcare, that is a major one when it comes to social determinants of health. And, you know, something as simple as to access to healthcare. You know, does your community, your city, your county, do they have primary care clinics? Do they have specialty clinics? If you have an issue that your primary provider identifies or diagnoses, is there a provider in your neighborhood, or how far do you have to drive to get specialty care? How much is it going to cost? And then even if some neighborhoods don't even have access to primary care, how do you define primary care? Is it talking to a nurse? Is it talking to a doctor? Is it just having a screening? You know, in some areas, the pharmacy is taking that role because there's not providers in town. And, you know, if you look at the communities in Alabama that are medically deprived, that they're medically underserved, that they don't have enough professionals, how do you, as an individual that is providing care, how do you help, how do you assess what kind of care is in your community? And then, you know, and then how do you let others know that those services are there? You know, I think it's a 211. I think that is one of the best things that has happened in some communities where people can call 211 and ask just anything, any kind of service. And most of the time, they have an accurate an answer to your question. And if not, they tell you, we'll find out. But that is something that not everybody knows, that they can call 211. And in some areas I have asked that have a higher Spanish-speaking population, I asked, do you have a bilingual person? Or what do you do when you have a bilingual person? In regards to my clinic at Watley, we have interpreters on staff, and we have interpreters every day of the week. And, you know, we have information translated into Spanish. But okay, if you think about yourself and you think about your experiences and your family experiences, when do usually emergencies happen? It usually happens at night or on the weekend, right? So something as simple as you call the clinic and want to talk to your provider, I want you to inquire how many clinics have an answering service that can speak more than English. So access to care, you have the education, you have the knowledge, you know that you're not feeling good, but you're going to call your provider and there's nobody in the answering service that speaks your language. What happens? We don't have that service. And then, you know, if you add the literacy part, where what if you don't even know how to read? What if you don't even know how to ask the right questions? Even speaking your same language, that can affect access to health care. And then, you know, I know that I already have talked about the environment in your neighborhood, but if you're thinking about what, and especially when you're trying to promote increasing fruits and vegetables, increase physical activity, because that can prevent you from developing diabetes, that can help you to address obesity, that can help you to address issues with heart disease or high cholesterol. But what if in your neighborhood you don't have access to even a fresh apple? And maybe the apple that is in the fruit stand is all wrinkled and not fresh. What if you want that, but you don't have that support? I know that Alabama has a different task force, and they even have a fund where they are providing grants for neighborhoods to have accessibility to fresh fruits and vegetables. But how long is it going to last? Is it a one-time only, or are you changing the infrastructure, and are you changing the mentality where that can be sustainable within each community? What is the crime and violence in your community? Are you living in a neighborhood where you're even afraid of calling if you're a victim of crime, because if you don't have papers, the fear is that you're going to get deported? Or that you might be on parole, and if you call the police, what does that mean? Do you break your parole? Or what does it mean if you are in a neighborhood that there might be some gang activity and they have you already marked? Would you call the police? So all those factors affect the stress, affect the life of an individual and a community and a family. The quality of housing. You know, we are involved within public health. You guys are involved. I'm a retired public health. I keep saying we. But, you know, we tend to think about communities where there has been meth production. If meth was being produced in a house and then somebody moves into that house, has that house been cleaned? There's children that have had issues with skin because of the meth that had been produced and not cleaned. Then, you know, with issues of lead, there's parts in the neighborhood within Montgomery, in the outskirts of Montgomery, where the lead in the soil is high because of what used to be there. and, you know, the child's lead gets tested when they come to the health department where they do the screening at home. But if the message is not related to the mother, how do you know that the lead level of that child is being under control? And yet we assume, or we want to think, that everybody has a decent house to live in. So the best part to last is how do you utilize resources to address the social determinants of health? You know, my advice is, you know, partner with different agencies. Know who's around where you're working at. Know the different kind of programs they have. Don't think you have to reinvent the wheel. You know, just look at the resources that are available and then be the advocate, be the key to change. That even though certain programs are just for a certain population, that it would be better for the community at large if you are inclusive of all. And what do I mean inclusive of all? It doesn't mean just poor people. It doesn't mean just black people, white people, Latino people. Do your services provide for the gay, lesbian, transgender? Do your clinics, your staff, is your staff trained to deal with people that look different than you, that talk different than you? Do your staff have the biases to address the different people? Does your staff, your upper management, have the knowledge of, you know, what message are we giving? Are we being inclusive? Are we being, are we showing biases even within our policies and our procedures without knowing that you're doing that? You know, the other thing is also, I know resource directories have been for life, but how updated are your resource directories? Are your resource directories people-friendly, where you can, and now I know that the Office of Minority Health has partnered with some people and they have a mobile app with a resource directory, but it's a charge in the sense of keeping it updated, but also taking the time to teach your community that you have that available. I know that the Agency on Aging has a resource directory that is very detailed, but then if you have a low literacy register, something with a lot of information is going to be overwhelming. And then, you know, before, not even before, as you're doing your health campaigns or access to different programs, or as you're addressing different groups, take the time to know your community. Take the time to do an assessment. Take the time to see the health level, health status of your community, not as is portrayed by some, but through your eyes. Because sometimes what things are being published are probably a year or 2 years old. So what is going on? What changes have happened? What are the health status of the people living in that community? And then also, what is the social demographic level of that community you're trying to reach? Don't make assumptions that just certain groups have issues with drugs, with alcohol, with violence. That happens everywhere. And so who are your partners? Who are the people that want to deal with that issue, that are willing to play with you? I'll give you an example of my prenatal clinic that, you know, I was charged to try to increase women to come into care at the first trimester. And the interesting thing is that I made the assumption, I'm Latina to the bone marrow, that I knew everything about the Latino community and that I could go to the different stores and stuff and tell them about prenatal care offered at the clinic. And little did I know that what people also needed was all of the different social determinants of health that I have talked about education, the parents knowing where their kids could go, the mother knowing that she was safe in that clinic, that her information was going to be kept confidential, to teach them about how to make it to the clinic and the hours of service. So all that, I couldn't do it alone. But I did call my old partners of public health to come and collaborate with me. The Alabama County Extension is playing with me. The hospital is playing with me in the sense that they're providing pieces of the puzzle. And that, I believe, is my last slide, that each agency and each individual and community can be part of the puzzle, in that in order to address health status of a community, in order to address the social determinants of health, you have to have all the pieces together. So, do we have time for questions, or are there any questions?
We do have time for questions. We don't have any questions yet. We don't have any questions emailed or called in, but at this time, if you have questions, please do email or call us with those questions. I do think we have one question from an audience member.
Yes.
Not necessarily a question, but I just want to congratulate you on doing such a great job, and thank you for the information that you presented. It was very thorough, and you actually answered all of my questions. But I do want to kind of touch on the issue that you mentioned about working with various populations and making sure that your staff is trained to work with various populations, and to not have take your own biases into certain populations, and also the fact of being inclusive when you're addressing populations, because when you know populations that are most impacted by things and you only look to work with certain populations, other people may feel excluded. Right. So your point of making sure that it's inclusive when you do your education and your efforts, and also to making sure that your staff is trained appropriately, I think was right on point, because it's very important that you keep those things in mind.
And, just to add in something that I didn't touch because of time, but as you're inclusive of the people that you bring to the table, including your staff, is also your data. Your data has to be representative of all the groups that are within your community. Yes, sometimes data might be too small that you cannot address it, but that still happens. So, in regards to being inclusive of groups is do the assessment. Do the assessment not only of the people that you're trying to serve, but also the assessment of the perception of your staff. Does your staff, feel comfortable working with different populations? I also, at Watley, I work with the Hope Clinic, which is an HIV clinic, and I work with all sexual orientations. I have no issues. But there are some people in the clinic that feel uncomfortable. And so that's one training that we're doing, because you don't want that individual that has reached you for your service to feel that he or she is treated different just because of their sexual orientation. And so one of the things, just to add on to your comment, is know your own identity, not only as an individual, but as a provider, because your own biases and your own upbringing can affect how you relate to others. And how would you know your identity if you don't address the issue? And so I think that, training activities with the staff, like you guys had last week, I think it's a must, because then you know your own biases, and you also know things that you didn't think that you thought unless you were approached by it. So, yes, sir.
Where might one go to get information on specific cultures of folks that are coming into your clinic, or that you might find yourself serving? Okay,
so in regards to the neighborhood, the different populations that you're serving, one that I usually use, because if you're applying for grants, you have to have a reputable thing, is the census. However, the census is not representative of your neighborhood. The way that you can tell the cultures that are in where the area that you're trying to serve is go through your churches, go through the school, the places of employment, and then also CDC has good data in regards based on zip code. But I think that your two best places is your schools and your churches, because they know who the people that they're serving. And for example, in regards to different populations or information of different culture, the Office of Minority Health has a information center that you can reach by phone or online, where they have education information on how to deal with different cultures. Or if you have, like in Tuscaloosa, we're blessed to have several universities, so their Department of Different Studies has helped me also in different cultures that I'm seeing patients at the clinic that are not Latinas, that are from Europe and the Far East. I have reached them because I want to know if they have information of what is their perception to health and to access to health, so that I can know, and when they come, then I don't feel scared of asking the question, and that's how I learn about how to be inclusive of other cultures. I don't know if that answered your question, but that's what I do.
And we do have a caller from Montgomery with a question. You can go ahead with your question. We do have a caller from Montgomery with a call-in question. Caller, you can go ahead with your question.
Yes, I was trying to figure out, how do you approach a person when you were talking about trying to make sure that they know how to read?
With a call-in question. Caller, you can go ahead with your question.
Yes, I was trying to figure out, how do you approach a person when you were talking about trying to make sure that they know how to read? And the rest of my question was without offending them. How do you don't offend them where they think that you just assume that they can't read because they are Hispanic or of another nationality that's foreign to American?
The way that I would address that is, I would ask them, I would give them a form so that they can give me their name and their phone number and maybe something that they would like to learn. And if I see that the form is left empty, then I approach them and I say, may I help you fill the form? And most of the time, people say, well, I can't read English and I don't even know how to write in Spanish, since you mentioned the Latinos. But I'll give you an example. I'm doing a nutrition education program in an area in Holt in Tuscaloosa, and we have arrayed different groups of individuals. And I noticed that when I gave the survey, because we had a survey prior to starting the class, I know this guy wanted to participate and he wanted to be involved, but he didn't know how to read. And, when the lady that is teaching that class with me went to him and said, are you going to participate? Yes. And then he goes, but, and then she kind of didn't pick up on it, and so I went to him and I said, would you like help filling the survey? And he said, thank you very much, I would love that, I don't know how to read. And he was an African-American man in his mid-40s. And the way that you can approach him without being insulting is just ask if they need help. And then, not that. And if somebody knows how to read and write and you offer help and says, I'm doing it, but I'm taking my time, then you know that they don't need your help. And you do not insult them or undermine them. Did that answer your question?
She's emailed and said, thank you for your response. I was getting a lot of feedback on the phone, so I disconnected. Okay. But it sounds like you did answer her question.
All right. All right, then.
All right. Well, at this time, we don't have any more email questions or no other call-ins, so that's going to conclude our program for today. Thank you to Julia Sosa for sharing her knowledge with us today, and thank you for watching. As a reminder, you can watch the program on demand at alabamapublichealth.gov. The sign-in sheet and evaluation are available online. Thank you. Have a great day.